Unit 12 CVS questions. A client with complete heart block has had a permanent demand ventricular pacemaker inserted. The nurse assesses for proper pacemaker function by examining the ECG strip for the presence of pacemaker spikes. 1. Just after each T wave. 2. Before each QRS complex. 3. Just after each P wave. 4. Before each P wave. The correct answer is 2. Before each QRS complex. A client complains of cough tenderness on assessment. A nurse notes a positive Homan sign. The nurse next assesses the client for which of the following? 1. Coolness and pallor of the affected limb. 2. Diminished distal peripheral pulses. 3. Increased cough circumference. 4. Bilateral edema. The correct answer is 3. Increased cough circumference. A home care nurse has given instructions to a client who is beginning therapy with digoxin. The nurse would evaluate that the client needs reinforcement of the instructions if the client made which of the following statements? 1. I should call the doctor if my daily pulse rate is under 60 or over 100. 2. If I miss a dose, I should just take 2 the next day. 3. I shouldn't change brands without asking the doctor first. 4. The pills should be kept in their original container so that they don't get mixed up with my other medicines. The correct answer is 2. If I miss a dose, I should just take 2 the next day. A home care nurse has taught a client with a nursing diagnosis of decreased cardiac output about helpful lifestyle adaptations to promote health. Which of the following statements by the client best indicates that the client understands the information? 1. I will eat enough daily fiber to prevent staining a stool. 2. I will drink 2 to 3 ounces of liquor each night to promote vasodilation. 3. I will drink 3000 to 3.5 ml of fluid per day to promote renal perfusion. 4. I will try to exercise vigorously to strengthen cardiac reserve. The correct answer is 1. I will eat enough daily fiber to prevent straining at stool. A nurse is implementing a plan of care for the client with deep vein thrombosis of the right leg. Which intervention would the nurse avoid when delivering care to this client? 1. Elevation of the right leg. 2. Ambulation in the hall twice per shift. 3. Application of moist heat to the right leg. 4. Administration of acetaminophen. The correct answer is 2. Ambulation in the hall twice per shift. A home care nurse who is visiting a client is preparing to remove a dressing from a leg ulcer. When the nurse removes the dressing, the nurse notes that the ulcer is pale and deep and is surrounded by tissue that is cool to touch. The nurse would document that the client's leg ulcer most appropriately identifies which type of ulcer. 1. A vascular ulcer. 2. A venous stasis ulcer. 3. An arterial ulcer. 4. A stage 1 ulcer. The correct answer is 3. An arterial ulcer. A client has diagnosed with thromboangiitis obliterans. The nurse is identifying measures to help the client cope with lifestyle changes needed to control the disease process. The nurse plans to refer the client to which of the following? 1. Medical social worker. 2. Dietitian. 3. Smoking cessation program. 4. Pain management clinic. The correct answer is 3. Smoking cessation program. A client has nursing diagnosis of activity intolerance related to underlying cardiovascular disease, as evidenced by external fatigue and increased blood pressure. Which observation by the nurse best indicates client progress in meeting goals for this nursing diagnosis? 1. Choose a healthy diet that meets caloric needs. 2. Sleeps without awakening throughout the night. 3. Verbalize the benefits of increasing activity. 4. Ambulates 10 feet further each day. The correct answer is 4. Ambulates 10 feet further each day.